My name's Rob, I'm a type 1 diabetic, and I've been type 1 diabetic for almost 40 years now, so I've had a few experiences of what it's like to live with the condition. For me, one of the biggest problems of diabetes, and has always been one of the biggest problems for diabetes, is dealing with hypos, hypoglycemia. The medics tell us that's when our blood sugar levels fall below 4.0 millimoles per litre.
Hypoglycemia is the medical term for a state produced by a lower than normal level of blood glucose.
For me, a hypo is more to do with when my blood sugar falls so low that I feel uncomfortable and can't look after myself properly. I feel I need to take some action to stop this situation getting worse. So, over my history of diabetes, for various reasons, I've felt hypo and my blood sugar levels have been 7, 8, 9 or 10, which wouldn't be a clinical hypo from our doctor's perspective, but to me I had the signs and symptoms and I acted on those signs and symptoms. The signs and symptoms for me tend to be I get very sweaty, I get very cold and clammy, I get very anxious, I'm not sure of where I am, what's going on. And those to me are the early stages of my blood glucose level dropping, and that's when I find I need to do something about it. The way I treat my diabetes is to resolve hypos with either a few biscuits, or I usually carry a packet of fruit pastels around with me. I find that the sugar coating on the outside of a fruit pastel, when I suck it, is very quick at bringing my blood glucose level up. And then there's the jelly bit inside, which is also quite sweet and helps. So if I'm walking around at work or if I'm at home, I've usually got a packet of fruit pastels in my pocket. Again, over the years that I've been diabetic, I've always had this bedside table of instant hypo aids at my side, and it almost becomes a reaction. Wake up in the night, things aren't quite right. I don't bother taking blood glucose levels at that time in the morning. I know I'm having a hypo. I know what it's like. I don't need to wait those minutes to do a blood glucose test. It's just hand out, pick up the hypo stop or whatever, and take it. And that works instantly and very well for me. One of my other strategic stores is, as I say, downstairs in the kitchen. And in the kitchen I'll have a can of full fat and full sugar Coke and a bottle of Lucozade, and again my hypo gel. There's always biscuits, because there's kids in the house, there's always biscuits down there, but I'm just looking for some form of longer acting carbohydrate for when I've had my upstairs hypo and I've come downstairs to have some long acting carbohydrates, so it'll be cereal, bread or toast.